now within our grasp, where Jamaica becomes the place of choice to live, work, raise families, and do business. We will not let go of this vision. We will grow. We will overcome these challenging times and look to the future with hope and positivity. These are special times. The world as we know it has changed, but home will always be in our hearts. And in Jamaica, you can always find a home. Think you know Jamaica? Look again. You will be surprised.
And seconded by Member Lawrence. We're gonna try not to keep you too long today. Thank you very much for all being here at our Economy and Production Committee meeting. We believe that many Jamaicans are still not at a place where they have an appreciation of what COVID has done to Jamaica for the last almost 2 years. March is going to make it 2 solid years. So about a year and 9 months, we have been almost in a situation of, yes, having done well, having grown and felt that we were ready to leap off in terms of the economy to the benefit of every single Jamaican. I don't think even many of our employees who are still hesitant about being vaccinated understand the implication that it has for the same businesses that they hope will continue to pay their salaries and continue to ensure their survival. And so we thought it was necessary for us to have a session like this so that we could reach out to the wider Jamaica that depends on manufacturers, private sector, for their own sustenance, so that they have an appreciation for how the entire country fits as a whole, from business to them as individuals, as employees, and sometimes dependents of employees going through this COVID situation. For many Jamaicans, we get a sense that they believe somebody else will take the vaccine, then the numbers will improve with somebody else, and when somebody else makes sure that we are able to curtail COVID, then I don't have to get it done. I hope coming out of our discussions today, more and more Jamaicans will understand there is nobody else. We all have to do it, each and every one of us, to protect the economy, to protect ourselves, because we are all a part of the process. So thanks very much. We are going to take PIOJ first, just to give us a quick sort of overview and background. I believe members from PSOJ need to leave early today, and we're going to try to keep you in the time slot that you indicated before. Thank you very much.
All right, thank you very much, Madam Chair, members of the committee, and colleagues from the private sector and the JEF. Good afternoon. Accompanying me today from the PIOJ are Mr. James Stewart, the Senior Director, Economic Planning and Research Division, and Ms. Nyasha Garraway, Director, Macroeconomy and Trade Unit of the Economic Planning and Research Division. My presentation today will speak on the COVID-19 pandemic and its impact on Jamaica's economy, with special focus on the real sector and labor market performance. In order to understand the impact of the COVID-19 pandemic on the Jamaican economy, it is important to understand the evolution of the virus globally and the global policy response to save lives, that is, the public health and social measures implemented and economic measures implemented to cushion the impact on economies. I will then speak to the impact of the pandemic and public health and social measures on the Jamaica's economy for the fiscal year 2020-2021. And finally, I'll speak to Jamaica's recovery within the context of COVID-19 and conclude with key takeaways. The COVID-19 pandemic, with approximately 253.6 million confirmed cases and approximately 5.1 million deaths globally as at 16 November 2021, has led to the largest peacetime decline in global economic activity in 2020 since the Great Depression. In November 2021, the COVID-19 outbreak was in its 21st month since the first case was confirmed in Jamaica on March 10, 2020. As at November 16, 2021, COVID-19 confirmed cases were 90,341, and there were 2,331 COVID-19 related deaths. Since January 31, 2020, rules of quarantine in relation to COVID-19 for inbound international travelers from specified areas or territories were issued by some countries globally. After the first case was identified in Jamaica in March 2020 and the World Health Organization, WHO, declaring COVID-19 a pandemic in March 11, 2020, the country was declared a disaster area under the Disaster Risk Management Act of 2015, Disaster Area Order 2020. The Ministry of Health and Wellness Emergency Operations Center, HEOC, was activated and was enhanced to coordinate the response in Jamaica. In keeping with the COVID-19 response plan for the health sector, a risk communication and community engagement program, as well as an enhanced surveillance program, was launched. As cases increased steadily throughout March 2020, governments globally introduced several other public health and social measures to contain the spread. The measures included the imposition of curfews, ban on public gatherings, closure of schools and early childhood institutions, closure of air and seaports to passenger traffic, imposition of work from home mandates, the wearing of masks in public spaces, restrictions on hospital and infirmary visits, and scaling down outpatient clinics. The restrictions were modified at various times throughout the year, contingent on the evolution of the virus. The public health and social measures were implemented globally at different times and to different degrees as there was a drive to stem the spread of the pandemic. The imposition of these measures, while necessary to save lives, had significant negative implications for economic growth and employment. To mitigate the fallout in economic activities associated with COVID-19 and the public health and social measures implemented to stem its spread, governments globally implemented various economic stimuli through both fiscal and monetary policy. Jamaica implemented various initiatives to support the economy, which included various tax cuts and targeted expenditure measures to protect jobs and the most vulnerable segments of society. One of the flagship initiatives was the COVID-19 allocation of resources for employees, the CARE program, which is the government of Jamaica's temporary cash transfer program, which aimed to ameliorate the economic fallout of the COVID-19 pandemic on individuals and businesses. Components of the CARE program included supporting employees with transfer of cash, the Set Cash program, COVID-19 general grants, COVID-19 compassionate grants, and business employee support and transfer of cash, the Best Cash. I will now speak to the impact of COVID-19 on the Jamaican economy. COVID-19 and the public health and social measures implemented to stem its spread led to the largest peacetime decline in economic activity, with the global economy declining by an estimated 3.1%, despite the various stimulus measures implemented to cushion the economic fallout. The fallout was greatest for countries like Jamaica, which are dependent on people movement and gathering, such as the tourism industry. Jamaica's real GDP contracted by an estimated 11% for fiscal year 2020-2021. The services industry, which bore the brunt of the impact of COVID-19, was estimated to have contracted by 12.7%, while the goods producing industry declined by 3.4%. This represents the largest decline since Jamaica started to record fiscal year GDP. That is, since fiscal year 1996-97, with the lowest level of real GDP since fiscal year 2001-2002. The fiscal year 2020-2021 was also impacted by, one, weakened business and consumer confidence, as well as weakened demand associated with uncertainties regarding the duration and impact of the pandemic. Two, lower income due to job losses and reduced work hours. Three, lower production within the mining and quarrying industry following the temporary closure of Jamaica's largest alumina refinery in September 2019 to upgrade production capacity. All industries, with the exception of construction and producers of government services, recorded contractions in real value added. The industries which had the largest drag on growth were hotels and restaurants, which was down 65.6%, reflecting largely a sharp decline in global travel, owing to the closure of international borders and a hesitancy to travel, resulting in a sharp decrease in visitor arrivals. The demand for restaurant services also fell and were negatively impacted by the imposition of curfews. There was also other services, which was down 28.2%, due to the ban placed on gathering for entertainment and sporting events and fewer visitors at attractions. And also transport, storage and communication was down 13.6% due to declines in air and maritime transport. The contraction in the economy was partially tempered by an expansion in construction activities, which grew by 2.9%, largely associated with increased activities in the building construction and other construction components. Recent data from the Statistical Institute of Jamaica, Statin, for the first quarter of the current fiscal year, that's fiscal year 2021-22, particularly the April to June 2021 quarter, show that GDP for the Jamaican economy was estimated to have grown by 14.2% compared with the corresponding quarter of 2020. The outturn represents partial recovery of economic activity in most industries relative to the low output levels recorded during April to June 2020, when the economy contracted by 18.4%, the largest quarterly contraction on record. The outturn for the period was due to the impact of the relaxation of measures implemented to manage the COVID-19 pandemic relative to the corresponding quarter of 2020, when the country was under more restrictive public health and social measures. Specific developments during the April to June 2021 quarter contributing to the positive outturn were: one, increased domestic and external demand for Jamaica's goods and services, consequent on the relaxation of COVID-19 measures, due mainly to the increased rollout of vaccination efforts globally. Two, domestic demand was spurred by higher levels of employment relative to layoffs and early closures in the corresponding quarter of 2020. Three, increased operating hours for businesses, which facilitated higher capacity utilization rates and production levels. Four, an increase in the implementation of residential and commercial building projects and road construction works. And five, improved weather conditions, which facilitated growth in the agriculture and electricity and water supply industries. And six, higher levels of business confidence associated with the prospects for a strengthened economic outturn. The main drivers of growth were hotels and restaurants, which was estimated to have grown by 334.6%, reflecting a sharp increase in foreign national arrivals, with approximately 344,000 foreign nationals visiting the country, relative to approximately 6,000 foreign nationals in the corresponding quarter of 2020. Other services was up 23.2%, reflecting partial opening of some entertainment and sporting activities and increased visitor arrivals. Wholesale and retail trade, repairs, installation of machinery and equipment, which grew by 19.3%, reflecting increased output from related industries, agriculture, manufacturing and construction, as well as increased demand stemming from an increase in employment. Construction was up 17.4%, driven by increases in the building construction and other construction components. And transport, storage and communication was up by an estimated 13.9%, partly reflecting an increase in total passenger movement, arrivals in transit and departure by over 800,000 persons. The economy is expected to grow for the remainder of the fiscal year. I'll now speak to the labour market developments immediately after the COVID-19 pandemic and how the labour market has recovered since. Due to COVID-19, a labor force survey was not fielded by Statin in April 2020, as would be normal. And therefore, the July 2020 survey will be used to gauge the impact of COVID-19 on its pre-COVID high in employment in January 2020. While it includes some seasonality, it tells a story of how the employed labor market was impacted. The employed labor force declined by 151,100 persons to 1,121,600 persons in July 2020, relative to January 2020. To put this decline in context, it took Jamaica approximately 3 years for employment to decline by 90,900 in the global economic crisis of 2008. The decline in the employed labor force between January 2020 and July 2020 had a larger impact on certain groups of society. The most negatively impacted were females, who accounted for 53.5% of the decline, youth aged 14 to 24 years, whose unemployment rate increased to 30.3% in July 2020 from 19% in January 2020, while the overall unemployment rate, which increased to 12.6% in July 2020 from 7.3% in January 2020, showing the disproportionate impact on the youth. Persons who had no formal training accounted for 88.3% of the decline in employment, and those who worked in industries that relied heavily on people movement and whose business operating hours were curtailed as a result of the public health and social measures, such as the wholesale and retail trade and accommodation and food services activities. These outcomes would have had negative implications for poverty and inequality in 2020. Most recent data from Statin for July 2021 reveal that the Jamaican labor market has started the recovery process. The employment level increased by 93,400 to 1,215,000 persons in July 2021, relative to July 2020. This increase represents 61.8% of the employment lost between January 2020 and July 2020. This has contributed to the unemployment rate falling from 12.6% in July 2020 to 8.5% in July 2021. The July 2021 labor market outturn suggests that the Jamaican labor market has begun to recover. However, COVID-19 continues to have an impact on employment levels and the pace and type of recovery by industry, occupation group, sex, age, and training received. Vulnerable groups, including females, the elderly, and persons with no training, are disproportionately negatively affected, partly reflecting that they account for the majority in industries that are still negatively impacted by COVID-19 and the public health and social measures implemented to stem its spread. I'll now speak to the outlook for Jamaica's economic recovery within the context of the COVID-19 pandemic and the importance of vaccination in the pace and sustainability of the recovery. Both the global and local recovery efforts will depend on the ability of economies to return to normal, that is, on the gradual removal of public health and social measures that restrict economic activity, as well as economic stimulus being undertaken locally and globally. The longer it takes for economies to recover, the more likely there will be economic scarring. That is, some businesses will be permanently closed and some jobs will be permanently lost. This is of greatest concern for micro, small, and medium-sized enterprises, MSMEs, and for the vulnerable population. Furthermore, protracted periods of unemployment may cause a growing discouragement as some persons give up actively seeking work. The potential negative medium to long-term impact that business closure and job losses can have on investment in human and physical capital could lead to lower long-run growth and welfare. The gradual relaxation of the public health and social measures will be a function of the rate of new COVID-19 reproduction rates and its associated hospitalization and deaths. A sustainable relaxation of public health and social measures will only be achieved when the society reaches a point where each new COVID-19 case results in the infection of less than one person. That is a reproduction rate below 1. The safest and most sustainable way to achieve this is through having a large proportion of the population vaccinated. While Jamaica has begun the recovery process, evidenced by growth of 14.2% in the April to June 2021 quarter relative to April to June 2020, and the employment increasing by 93,400 persons to 1,215,000 persons in July 2021 relative to July 2020, the economy is still vulnerable to a new wave of COVID-19 cases and its associated hospitalization and deaths, mainly due to the relatively low vaccination rate. This vulnerability is compounded by the potential for new variants that are more transmissible and lethal, which may necessitate a reimposition of public health and social measures that restrict movement and, by extension, economic activity. So in conclusion, the key takeaways from the PIUJ's presentation are the Jamaican economy continues to be negatively impacted by COVID-19 and measures implemented to stop its spread, albeit to a lesser extent compared with fiscal year 2020-2021, when the economy contracted by 11%. 2, the economy began the recovery process in the first quarter of fiscal year 2021-22. April to June 2021, expanding by an estimated 14.2%, mainly as a result of a relaxation of measures implemented to stem the spread of the virus, as the rate of vaccination increased globally. Additionally, employment has increased by 93,400 persons to 1,215,000 persons in July 2021 relative to July 2020. However, both GDP and employment levels are still below their pre-COVID highs. The pace of recovery for each sector has been different, partly reflecting source of demand. For example, growth was driven mainly by hotels and restaurants, some 334.6%, and other services, which includes recreational, cultural, and sporting activities, up some 23.2%, that benefited from increased visitor arrivals as a result of relatively high vaccination rates in main source markets, as well as initiatives undertaken locally, including vaccination and the establishment of a resilient corridor to prepare for visitors. Despite these increases, these industries are still below their pre-COVID-19 levels. Economic activity has been uneven, especially within the labor market. It is observed that activities that employ the most vulnerable populations, females, youth, the elderly, and persons not trained, are recovering relatively slower than the rest of the economy to date. The longer it takes for the economy to recover, the more likely there will be permanent scarring. That's closure of businesses and persons who may stop actively seeking jobs, where the most vulnerable will be disproportionately impacted. Increasing the vaccination rate in Jamaica is the safest and most sustainable way to stem the spread of COVID-19 and its associated hospitalization and deaths, which will facilitate a further relaxation of the public health and social measures, which is essential for productivity and growth. The resurgence of COVID-19 and reimposition of public health and social measures remain the main downside risk to the growth forecasts. The pace of recovery will depend on Jamaicans observing protocols and continuing to work together to reduce the impact of COVID-19 on the economy, to make Jamaica the place of choice to live, work, raise families, and do business. Thank you very much.
Thank you, Dr. Henry. Members, I'm going to ask you to hold your questions so that we allow PSOJ to make their presentation. Dr. Henry, when we are finished, and if someone could also make these notes from PSOJ, we would love to be able, if you're able to determine what the one impact of the relaxations are on especially the MSMEs, and generally for you from PSOJ, the economy in respect of the new measures going into December. So if you're able to actually give information for a month and give us an idea how soon PIOJ would be able to give us the quarter, July to September, so that we can see exactly what the trajectory is like. We'd love to know relaxation, particularly in terms of vaccinated persons being able to come and move about and do their business with doing their PCI tests, and some of the other measures increasing the volume of persons who can move around and have entertainment activities. So the PSOJ, and then we will come back to you and the team, Dr. Henry. Mr. Stokes.
Thank you, Madam Chair. Good afternoon to you and committee members. Thanks for your invitation. I'm here today with two of my colleagues, Mrs. Imiga Breeze McNabb, Executive Director of the PSOJ, and Ms. Safri Brown, the project lead for the Private Sector Vaccine Initiative program. So we were told that we have 15 minutes, so I'm going to try and go through pretty quickly. We are going to meet the 15 minutes. The presentation format, so I will talk briefly about the economy, impact that we have seen from our membership, and then we will transition to my colleagues who will talk about vaccination and some recommendations in terms of ways to sustainably open or reopen the economy. So if we move to the first slide, Amigo, as Dr. Henry would have indicated, the COVID impact on the economy has been material and felt widely across the different sectors or industry. Recently, the PSOJ conducted a survey of its membership to get what I would call a first-hand view of the actual impact on members. That survey was conducted between the end of September to around October 22. And some of that data was submitted to your committee, Madam Chair. So you can have the benefit of looking at that, and at a future date we can even talk more on what the findings are from the survey. But the major punchline, or certainly what I want to indicate from that survey, was the material impact on the MSME sector, and importantly, that many of our members have been very active with innovating and investing in their businesses to alleviate the impact that we have seen from the COVID measures. So if I were to talk a little bit more about the MSME sector, the impact on that sector has been outsized. So while the overall impact on the economy is estimated at about a 10% reduction in output, our estimate suggests 20%, almost twice the impact on the MSME sector, which is quite material and intuitively actually not very surprising when you think about that many of these entities are vulnerable or certainly have less capital or liquidity and just not in a very good place to pivot to deal with a number of the measures that have been implemented to stem the spread of the virus. Madam Chair, we are far from seeing the light at the end of the tunnel from this COVID pandemic. COVID, has created havoc, I would say, on key areas of our economy. For example, education, and that's one of the major concerns that we have as an organization, certainly as it relates to the long-run economic capabilities of our country. The fact that so many of our children are still not in an optimal educational system, and they are important, what I would call social stratification that is taking place because of the measures that have been implemented and the fact that kids haven't been able to go to school in an optimum way. And that is certainly something that, we encourage the government to look at and to see how we can safely return our kids to school so that a lot of the unintended consequences can be mitigated. The other impact that I should mention as well from COVID is the significant disruption in logistics and supply chain. And this is having what I would call second round economic effects. Second round in the sense that inflation or prices have been increased given the disruption to global logistics and supply. And many central banks, including our own here, Bank of Jamaica, have responded by raising interest rates. Now, one of the consequences of raising interest rates to stem the elevated prices is a reduction in economic output. So already, as you heard from the PIOJ, the growth forecast is stunted from the COVID measures. And these will be exacerbated by the Bank of Jamaica raising interest rates to stem inflation. So that is of material concern to the PSOJ. Madam Chair, another issue of concern to the private sector is Jamaica's relatively low vaccination rate. And I think on the graph that is there, I'm not sure how many persons can see it, but for those who have the presentation, you will see that we are close to the bottom of the pile in terms of our vaccination rate, which is a major problem, right? And if you think about it intuitively, vaccination rate represents a leading indicator of hospitalization and ultimately death rates, right? Or I should say low vaccination rate is a leading indicator of hospitalization and death rates. So intuitively, we believe the low vaccination rate will result in an uneven and ultimately a slower economic recovery for Jamaica. And as you can see, I'm echoing some of what came from the PIOJ, and we actually didn't compare notes before. If you look now at the going forward, right, and I just conclude my section here in terms of the economic impact. The IMF estimates that the Latin American Caribbean region will still be well below the 2019 peak level of GDP in 22. In other words, when we get to next year, our economy, we expect, will still be below the 2019 peak level of output. And as I indicated before, some of the measures that are being implemented locally, not just the pandemic measures, but the monetary policy conditions will also weigh heavily on this recovery. The PSOJ chair and its membership have been active collaborators with the government. We have engaged the government on a number of initiatives, right, to help to alleviate the COVID measures and just generally the economic fallout. And one of these important initiatives that we have collaborated with the government on is the private sector vaccine initiative, something that we take very seriously. We believe the vaccine effort is very, very important to our economic recovery and indeed our long-run development potential in terms of its impact on kids returning to school. And I want to, Chair, just segue to my colleague Safri here, just to talk about some of what we're doing in terms of the PSVI, sorry. And, as I indicated, we will close with Amiga talking about some of the recommendations to safely reopen our economy. Safri.
Thanks, Adrian. Good afternoon, members. So, Chair, a little bit about the PSVI. The PSVI was really formed earlier this year to support the Ministry of Health and Wellness with their national vaccination plan, really with the aim of getting us to population immunity, which had been set at 65% of the population. Our focus initially was really on the productive sector, how we support getting the productive sector, private sector and others back to work, getting them vaccinated, and what we need to do to put into place to make that happen. We started to look a little bit more at some support of the general public. We started to work on community vaccinations and school vaccinations. Again, looking at companies who've been willing to put forward as part of their corporate social responsibility to continue helping with these national vaccination efforts. And our involvement has really been in kind of three key areas. We've looked at vaccine administration, we've looked at education, and we've looked at access. If we look specifically at administration, the PSVI has really been involved with the data management system for the COVID vaccination. So we donated 400 tablets to the Ministry of Health, which were the tablets used when they initially started to roll out the ComCare system at sites across the island. We quarterbacked the implementation of the ComCare system in partnership with UNICEF and with the Ministry of Health. And that's really the digital vaccine administration system that we have. And that will allow us now to segue into a vaccine passport, which is also currently being worked on by the same partners. And then we also got involved in helping to clear the backlog of paper entries. At the beginning, we had about 130,000 paper entries that needed to be put on the system, and we were involved in helping to clear that backlog. In terms of education, we've done a lot of work in terms of really trying to promote vaccine education and take-up. We've done a lot of work with some of our private sector companies doing vaccine education. We've started partnership with the Medical Association of Jamaica. What we're finding is that credibility of the messenger matters a lot, and making sure that you're giving them access to individuals who can answer especially medical questions is proving to be an essential part of our vaccination program. And it's something that we're really looking at how we can scale that and how we can get that kind of expertise and credibility into communities that maybe don't have access to being able to ask those questions one-on-one. It is clear that people do have a lot of concerns. And they have a lot of information that needs to be answered. And we have to really take the time and the effort and the energy to answer those questions. And a lot of those conversations have to happen one-on-one, which makes it very difficult because we are looking at scaling and how do we scale if we need to be having one-on-one conversations. But obviously we have to find a solution. We've also been involved in developing a toolkit, which has been supported by the protocols that have come out of PSOJ, GMEA, JEF, and some other partners that really outline for a company what are the steps that you can take in terms of, getting your staff from a point of information and education to opening up opportunities to be vaccinated. And so we continue to work with them on that. And then when we look at access, access is important, and we have to understand access from a number of perspectives. And I'll talk a little bit about that on the next slide. But in terms of physical access, we've conducted about 125 different vaccination days. We've been in all parishes across Jamaica. We've directly vaccinated just over 35,000 people. And we've done a lot of work to drive members of the private sector to government sites, because obviously we might have 3 sites in a day and the government might have 80. So we encourage them wherever they are to continue using the government sites. And so we make sure we get information out to them as soon as possible. So in terms of what we're looking at a really slow vaccination rate. Unfortunately, the anticipation is that it will continue to slow down, but at the current rate, we're looking at achieving our target by March 2023, which is 12 months later than we had wanted, or that was our target. And again, that's at the current rate. And even though we might have little surges, for example, if Pfizer comes in and opens up, you might see a little blip. Generally, what we're finding is the surges are sort of ending quicker than we had hoped. And whilst I know we complained about long lines at vaccination centres, right now I would give anything for some long lines at the vaccination centres. And so, as indicated by the previous presenters, the economic recovery will be hindered. In terms of the companies, private sector, the PSO did a response and impact survey recently, and what they found was that 50% of the companies polled had at least 50% partially or fully vaccinated of their employees. 31% had over 75% partially or fully vaccinated. The majority of the companies we find do have vaccination programs in place and guidance towards vaccination. So they are actively working on getting their employees vaccinated, getting them the information. They've spent a lot of time and resources on trying to get information and provide forums for conversation. 15% of the companies require vaccination. Again, this is from the survey, and 77% encourage vaccination. And again, under that encouragement, we continue to try and support with the protocols and the measures in the workplace that they can continue to look at. So in terms of vaccine hesitancy, I know this is really one of the hardest things that we're dealing with. I think when we started back in March, we knew there was some hesitancy. I don't quite think that we all grasped how much hesitancy there was out there. And so now we've got to really look at what we need to put in place as a nation in terms of all the partners, everybody at the table, to look at this. We've got to look at access. And as I mentioned, access is not just about physical access, it's also about trust and confidence in the vaccination process. So making sure that the process is clearly communicated, clearly articulated, is something that can be trustworthy, that the system works. And that we have to remove the barriers, such as this mistrust. So we need to look at who are the trusted parties in communities. We need to utilize data to be able to understand where the gaps are, who's not getting vaccinated, for what reason are they not getting vaccinated, and we need to get people in there who they trust to talk to them about it. And then that goes to the education. So we need to target segments with specific messaging. And again, we're at the point now where we've got to get on the ground. And we've got to get into communities and populations. So when I say populations, I'm talking about any specific vulnerable populations as well, and making sure that we're specifically working with them. And then obviously we've got to combat misinformation, but we can't be passive in that. We've got to actively combat misinformation. So if we know that women of reproductive age have concerns about certain things to do with the vaccine, we've got to come out with a clear statement about what the health position really is, and we've all got to be able to support that. And so I think we have to be a little bit more proactive about actively combating misinformation, because there is a huge amount out there and it is being churned out daily. And then policy, the research is showing that vaccine policies work, and obviously there's a whole spectrum of vaccine policies, and you can go from a basic policy, to a very in-depth policy that ends in a specific requirement. But we do find that vaccine policies do in fact work.
Afternoon, Chair, committee members, other presenters. So due to this high level of hesitancy and low vaccination rate, Jamaica's response to the COVID-19 pandemic has continued to be the use of non-medical interventions, as mentioned by the PIOJ. But we believe from a private sector that other options are required to operate in this new norm that we're in. So when we did the studies and looked internationally, we realized that countries such as Italy, they have a green pass, France, a health pass. And when we looked at the numbers, vaccine requirements or options, they actually increase vaccination rates on average of 30%. And we believe that this should be a part of Jamaica's solution to safeguard our citizens. So some of our recommended next steps, and I must say that these are aligned to the recommendations that would have been made by the Vaccination Operationalization Task Force. We have 7 things that we see as critical, that we need to indicate the clear timelines and strategy to reopen the economy. We need to expand the access points for vaccination, and Safi would have mentioned how we're working with the doctors to get them more involved. Develop the health and other required infrastructure to support the new wave, if we are to have new wave with these pulling back on the current restrictions. We need to create a robust PCR and antigen testing regime, because if the responsibility is now on us as citizens, we should be able to know our status more easily and readily to act appropriately. And as Safri would have mentioned, roll out community engagement and be very targeted in our communication strategies. And we also feel that we need to go back to protecting the vulnerable and targeting them, because the vaccination rates are very low with the 60 and over age group that continue to be the vulnerable ones who will end up in the hospitals and so forth. And we believe that key to achieving all of this, because there are different elements to recovery and living in the new norm, and it requires great focus and resources and the skill sets. And we believe that there are certain governance structures or regime and project management structures that need to be implemented to ensure that we're focusing on these key elements and we can monitor the outcomes of the different areas. Thank you.
Thank you. Members, do anyone have questions for PSOJ? Because PSOJ had indicated before that they would have had to leave early, I'll just say generally, even from the presentation, you have not pat yourself on the shoulder enough in terms of the cost of being a part of the initiative of getting Jamaicans vaccinated across businesses. As members of parliament, we do hold vaccination blitz. Sometimes we may have to get the tents and the chairs and food for the medical professionals. And I can tell you, as a member of parliament myself, I'm livid at how much it is costing me. But it actually costs the persons who partake in PSVI, the private sector vaccination initiative, even more. My understanding is for each one of those initiatives, they have to rake out $3,150 US, which means every one of those initiatives to get persons vaccinated cost them somewhere in the region of $500,000 Jamaican dollars just for the initiative. And then they still have to find all of those tents and chairs and food and water and get persons out and get them vaccinated from the various companies. What I would love as chair coming out of just listening to the discourse is a greater sense for Jamaicans to understand that if you work with a company, yes, they may not be able to force you to get vaccinated. They may not be able to mandate that you get vaccinated. But something I picked up just listening to persons in the private sector is that they're not accepting new employees who are unvaccinated. And I think it would be something that PSOJ should continue to push to Jamaicans so that they understand that getting a job, moving from one job to another, may find you in a position that not being vaccinated is a barrier to your entry into a new organization. And it may help more persons to understand that vaccination saves many, many more lives. We are not in a place in Jamaica where we can show any cases of persons having died because they took the vaccination. But we have so many people dying because they have not. And if you want to be an active part of the job market, particularly in small companies where your employer, because they have 5, 10 people, cannot afford to shut down the company, to sanitize, to have all their employees tested, and to keep going through that cycle because it destroys their business and it destroys their ability to continue to employ you, that you have to get up and go out and get vaccinated. So I really commend the efforts of PSOJ and the fact that you have literally borne a significant burden of the cost in getting your initiatives done so that Jamaicans know you are doing the work. We really thank you. I would love, even if we do not invite you to come back, that you continue to give us some reports at least for the next year, if we're in this position of what we are looking like. Listening to you saying that MSMEs are in a position that their decline is at 20% compared to the average GDP decline of some 9.9%. Many persons may not get it. Small businesses drive Jamaica. Small businesses employ a substantial portion of individuals, particularly those who sometimes are undereducated as well, do not necessarily have the skills. MSMEs have invested in these individuals. If they do not become a part of the solution, we are going to suffer suffer for an extended period, because we can look at all the ripple effects of crime and the impact on the economy of having our small businesses closing. So coming out of today's session, we are joining the PSOJ, joining other associations like the Manufacturers Association, Employers Federation. People need to get up and understand that their jobs are dependent on them being a part of the solution. And I thank you very much for being here. Coming out of today's session, you're going to see some of our video clips, because we believe, even from this particular parliamentary session, economic and production is not something people pay a lot of attention to, I'll tell you. They pay attention to PAC and PAAC, where we do a lot of quarreling. But today's session is so critical. You are going to find, I've already requested the clips from today's session, and you will see presentations being pushed and promoted from each individual here representing the various organizations, because we believe that we have to add to that effort in getting Jamaicans to understand how much you are doing to help and how much they have to contribute to getting us back to life. Thank you very much, PSOJ. So we'll release PSOJ, who indicated they needed to
Thank you
get
very
out
much,
of here
Madam Chair,
early.
Committee.
Dr. Henry, I'm sorry that we're holding you today. So we'll take the Jamaica Manufacturers and Exporters Association next.
Good afternoon. So, thank you. We also did a survey somewhat similar to the PSOJ, but the composition of our members are a little different. We have 400 or so members with about 80,000 employees, but a large part of our members are smaller and medium-sized companies. And what we found in our case was the smaller companies with less than 20%, 20 employees, tended to have a very low vaccination rate. The ones over 20 employees tended to have a higher rate of vaccinations, approximately 40% of the companies with more than 20 employees had a 40%. Those that were less, those with smaller numbers of employees, had a rate that was more similar to the national rate. The thing that we focused on more is the cost of the COVID-19 to our members, and tried to relate it to a per employee basis. So, you know, when you and I looked at my company and some of the other companies where who were directors of our group, and dug into the actual numbers. I won't go into the detail, but these costs include things such as the actual cost of the vaccination when you use the PSVI, the efforts that had to be made to encourage staff, to protect them, and so things like if a staff member had a family or that had COVID or came into contact with someone who had COVID, a number of companies gave those staff members time off with pay, not whether, in other words, whether they had exceeded their sick leave or whether they exceeded their vacation, in order to encourage staff members not to hide the fact that they had it. So, for instance, in our case, we tested every employee. Well, we've tested them twice. When we tested them the first time, we had 20% of the staff had COVID and had no underlying symptoms. So we thought that was really telling. And so we said, you know, we don't want to wait for them to have a symptom. But obviously, if they knew that they came into contact with someone or they had a family member, just tell us and we'll give them the time off. So that is costly. And in addition to that, we found that those who had the vaccine, who knows if it's true or not, but for the afternoon and the next day, they couldn't work. And so there was that cost. There was the cost of, you know, the additional cleaning. In our small factory, we had to hire 2 people full-time to do cleaning. You have to do all of the additional things, you know, that you all know about, including the sanitizing, buying masks and overalls, and that has to be continued. So, and of course, the lost production due to staff absences. So we actually quantified that at around, depending on the size of the company, $50,000 to $100,000 per employee per year. When we relate that to the 80,000 employees in the sector, we were coming up at over $5 billion in costs. That is not a small figure. And so we tried to put a figure on it so we knew we weren't just talking about you know, ambiguous or so costs. And of course, that does not include the companies who have actually closed down, and that's many companies, right? But to some extent, that is caught in your numbers of the economic decline. The other thing we also found, and I look at this in terms of companies that are on the junior stock exchange, and you can see their results. In 2020, the first year, they were hampered significantly by the sudden downturn in sales and business. But they then started to take action to reduce their cost of operation. And so they looked at themselves and they reduced the numbers of staff they had. They might have been doing things a certain way. They managed to increase their efficiency greatly. You know, so you can look at some of those companies, whether they are CPJ, even Dolphin Cove, which used to make $1 million a year US before COVID, on reduced sales in this last quarter, they made $1 million because they re-engineered, they closed down operations around the country and focused on one. So to some extent, that is good news when you have increased efficiency, so that when the economy eventually comes back, they will make excellent profits. But at the same time, companies who are investing in the future, and again, I refer to a company like Dolphin Cove, which may have had 4 or 5 locations, closing them down impacts on their ability to grow again, and it takes a longer time. But the good news is that if and when we come back to a regular, to more normalcy, we will have a more efficient set of manufacturers and other businesses, which is a good thing. The fact also, you know, that we have had increased freight rates and substantial. I want to tell you that it is between 14,000 US and 20,000 US to ship a 20-foot container. And it goes up beyond that. We found that our cost in Jamaica of shipping is around in that figure, 14,000 US. but to the east coast of the U.S. If those companies, those shipments to New York and Florida are even higher. We have customers that we ship to directly from the Far East. The shipping costs are upwards of $20,000. So what we are seeing is the shipping costs to Jamaica are less than the shipping costs from the Far East to New York. And that creates an opportunity for us in Jamaica, because now those companies in North America have to pay such a premium for shipping that companies in Jamaica who are manufacturing have a little bit of an advantage now over Far East companies. So that if you take a company like Boss Furniture, which makes furniture and bedding, freight costs are a significant part of their business. So if you are importing furniture into the US from the Far East, and you now have to pay $20,000 extra, a company in Jamaica who has a good quality product can ship to the US, because $20,000 US may represent 50% of the cost of the item. Boss Furniture has increased their exports to the Caribbean, and there are other examples of that. So we have to find a way of emphasizing this advantage. While it might not be permanent, we have to wake up to that fact and take advantage of it, because once you establish a customer, you can continue to ship to those customers. The fact is that those substantial freight costs and the increase in the raw material costs are having a big impact on our economy too. As you know, they recently announced that our inflation rate was 8.2%. I believe that is going to continue. That high inflation rate is not going to come down for a while, because cost increases have not stabilized yet. And so we expect to see the inflation rate continuing. I want to point out to you, hopefully this is not the wrong place to say it, but when the BOJ continues to increase their interest rate in an effort to reduce a foreign-induced cost inflation rate, it does not, in our opinion, help. And I give you an example. When one of the biggest impacts on our inflation rate is the increase in the cost of oil and gas for motor vehicles. When is Petrojam going to reduce their price that they sell their gas and oil to? Is it because the government, because the BOJ has put up their interest rate? They're not going to reduce the cost to the dealers, you know, because they can't. They say, yes, they have an opportunity. They make a margin, they make a profit. But are they going to now say, okay, because the interest rates are high and people can't buy as much and the economy is slowing, are they going to reduce their price? I don't think so. And that flows to the same thing. It flows to us as manufacturers and distributors of goods. Just because the economy slows, if your cost inputs are there and they're real, you have little opportunity to reduce your costs and stem inflation. And I want to get that across, because I think the BOJ feels that they're sending a signal to the commercial sector to temper their price increases, but they have little choice on that. The other thing I want to just get across to you is that in our survey to our members, and when we asked about vaccination rates and whether they mandated it or not, a big number of those respondents said they're waiting for guidance from the government to know what to do. And I am afraid to say to you that the government, although they know better, they have essentially given up on the idea of achieving 65% vaccination rate by March. Based on the numbers of people that have been vaccinated, and what needs, and the additional 3 million vaccinations that have to be given to reach 65% by March, it's clear that we are going to be well into the end of 2022, going into 2023. And unfortunately, what the government has telegraphed is that they are not going to mandate vaccinations, and they are also not going to go back to lockdown situations. And what I fear is going to happen this Christmas, as happened in the last Christmas and happened this summer, when you relax too much, and there is a lot of pressure on the government to relax. Christmas, if they relax and they allow parties and they allow mingling, and when our Jamaicans come from overseas to visit family, then they're not vaccinated and they mingle because they can't, we have a quarantine, but we can't control what happens because we physically don't have the capacity to do so. If we let things slide to give people a break in Christmas and we have another outbreak, the government again has said, you are the ones that are going to pay the price, and we're not going to overload the hospitals, and we're not going to create that situation again where people who need to see the doctor can't see it because it's overloaded with people with COVID. So I am concerned that the government is not taking a strong enough position. They themselves are concerned that somehow Jamaicans are going to revolt if we have a tough action. We take it, we as government take it to the people and not leave it up to the people to decide what to do. And if we have to go through another year and a half of a reduced economy because of curfews, it's going to continue that pain that you talked about, Dr. Henry. And then if you go the other way of just letting it go, and so many people get sick and so on, that is also a disastrous situation. So that is my message, Chair Lady. Thank you.
Thank you very much, Mr. Mahfood. We have Ministry of Labour and Social Security here. I don't know if they would like to take on that particular point. What I observed coming out of our thrust from industry and commerce, not from government, but from private sector, was a sense to start almost mandating at the private sector. I get a sense with persons going forward with some cases that there has been some element of backpedaling of some companies. And I guess there is a fear that if I'm not being joined by a substantial number of companies in going forward, and if I'm not getting the guidance from our labor laws that we can push forward, then nobody really wants to take on the risk and responsibility of being the odd man out pushing to mandate employees. So when Ministry of Labour takes the floor, I would also love to get an appreciation. If there is some sort of guidance, if there is anything in our laws that can guide organizations, employers, and even for the Employers Federation, what is the push from them in respect of their members in the direction that we can go if we are not of the mindset that Jamaicans would appreciate a mandate per se. I'm not even sure why we introduced the word, because there are ways of ensuring positive reinforcement without necessarily indicating to individuals that you're mandating that they do something. So I thank you for your presentation from the Jamaica Manufacturers Association and Exporters Association. And I would ask very quickly to have the Jamaica Employers Federation make their own presentation. Mr. David Wan.
Thank you, Madam Chair. Committee members and invited guests, good afternoon. Before I get into the presentation I have, Madam Chair, I would like to speak to that topic we just spoke about. What we've done is we've gotten together with groups such as the JMEA and JCTU, as a matter of fact. We sought some legal guidance as to how companies should handle, putting in place a vaccine policy. And we circulated that far and wide to our members, and it suggested a, legal way to have, in effect, a vaccine mandate without calling it a mandate and taking it through a process, ensuring that you give people a chance to, voice their objections, etc. Now, as to whether companies have taken it on, we're not sure if they've taken it on completely, because we can only encourage, we can't mandate, but we've done that, and we think it was well received. But the other element, Madam Chair, is there are some companies in court right now with this vaccine mandate. And our fear is that absent guidance from the authorities, a court case comes to a decision and it says that the court company's action was not legal, which says you can't force employees to do it, then that will become the norm, which means that we're going to have much more difficult time getting enough people vaccinated, because that court decision is going to set the precedent. That's what we're afraid of. But on to my presentation, Madam Chair. We're a trade union for business with over 340 members, primarily companies ranging from sole traders all the way to the largest employers in Jamaica. The pandemic has impacted all of our members in some way or another. A few have been impacted positively in financial terms, mainly food service establishments with delivery or drive-through facilities and cleaning and sanitization companies. But most have been impacted negatively by COVID. Like the JMEA, we polled our members and came with a little composite of the impact. And there are three main headings under which I want to speak about the impact. The first one is the productivity and cost of doing business and productivity of the employees. The second is a matter to do with labor legislation that has come to the fore because of COVID. And the third is the issue of the imported inflation, again mentioned by Mr. Mahfood, that impacts the cost of doing business, and we have an appeal to make in that regard. But first, how has this pandemic impacted our members in terms of productivity and cost of doing business? I just want to cite a couple examples of each. A productivity issue, increased absence due to illness or quarantine. And some companies have not withheld pay to date and being fairly generous for persons absent from work. That's a productivity issue. Another productivity issue is the lockdown days, especially those 3 consecutive lockdown days. It was definitely an impact on the firm's productivity. And then on to the cost issues. One of our large members has expended significant sums paying utility allowances, including light, water, internet, and mobile phone for those who have now transitioned to work from home. Another way the cost has increased, many companies have faced increased costs for purchasing laptops and contributing funding to set up of workspaces at home, desks and chairs, for those that did not have a laptop that could be carried home prior to the pandemic. So those are a couple of examples of the productivity and cost issues. I have more in my document, but I just wanted to highlight those 4. Moving on to the labor and legislation impact. Now, COVID has brought to the forefront a major issue for employers. and I speak about the 120-day layoff provision in the Labor Relations and Industrial Disputes Act. The specific example I want to cite, there were companies who were in an industry that was not yet allowed to reopen and had employees on layoff during the pandemic. But when the 120-day period expired, they had to either bring back the workers on full-time pay or make them redundant with the attendant costs after that 120-day period, even though the industry was not allowed to restart. So it is felt there should be a provision in this LRIDA that industries who have been ordered not to reopen by the government should have the benefit of some additional layoff periods beyond the 120 days, because it puts them in a position where there's no income coming in to the company, yet you are now faced with the cost of bringing back workers full-time or making them redundant. Both of those have costs, yet you're still not allowed to reopen. So that is probably the major piece of legislation that our members have complained about. And then I want to move on to inflation. COVID has caused supply chain problems and is causing higher inflation in many countries, and it affects the cost of doing business. The Bank of Jamaica has increased interest rates in response to increased inflation, a portion of which is imported. And my sense is that the bulk of it is imported due to supply chain problems in our major trading partners. We believe that the increased interest rates alone will not resolve this problem, and it may indeed exacerbate it. Since there's no supply chain problems within Jamaica that are of significance, we're advocating a program to incentivize domestic production, especially food production, in order to build our capacity to produce and sustain ourselves and to alleviate the inflation we're now experiencing. We think it's an opportune time to reinvigorate and bring back to the fore the whole Buy Jamaican concept so that we depend less on imports at this point in time. And I think it would help to solve some of the inflation problems we are importing from our trading partners. So, Madam Chair, those are the highlights of the presentation. So just to summarize, the impact on productivity and cost of doing business, the labor legislation that has not taken into account the incidence of pandemics, and the whole issue of inflation caused by the COVID and the supply chain problems, and our recommendation that we need to reinforce the Buy Jamaica, build it here and buy Jamaican, to try to offset this inflation and not to depend on monetary policy all by itself, which, as a matter of fact, if that's the only way we're going to try to deal with this, it might have the reverse effect. Okay, so I thank you for this opportunity, and I would like to say, I wish the Productivity Committee great success in fulfilling its mandate. Thank you.
Thank you very much, Mr. Wan. Ministry of Labour and Social Security.
Thank you, Madam Chair.
Mrs. Nelson, I hope you're ready to help us with that one. I can tell you I saw a communique from one individual about what would be the policy in respect of employers and mandates, and then I saw something else that appeared to come from the Ministry of Labour and Social Security. So I think we are all still a little bit confused in terms of what you can rely on from labor laws to be able to function as an employer. And this may be an opportunity to help guide employers right across the board in terms of the way they can go.
Thank you, Madam Chair. Good afternoon, everyone, committee members, colleagues. I'm Tamara Nelson, Chief Technical Director in charge of productivity at the Ministry of Labour and Social Security. And I'm joined by my colleague, Mrs. Gillian Carodas, who is the Divisional Director of Industrial and Allied Services. And so this presentation is going to be in a two-part presentation, where I will give an overview and introduction on the trends, both locally and internationally, and then Gillian will then take over and speak to the labor laws and other initiatives within the ministry. All right? Okay. So as we continue to live in what has been dubbed the new normal, Jamaica and the rest of the world has continued to learn what that means. And the way we interact through business, the economy, labor markets, and even education has changed and is evolving as we speak. And to ensure that our best chances for recovery, we must evolve with what is happening. And as we strategize and plan that on activities that will help the economy to recover and move forward, it is important that we are aware of some of the long-term impacts of what this period that we're going through and what it will have on the systems that we have in place, education, labor market, and overall human capital development. And research that we have seen will consistently show over time and that countries with greater educational attainment is associated with higher levels of growth and productivity. And we have found, based on our research, that education is a key attribute to human capital development and human and economic growth. And to maintain the health and to maintain the life of our citizens, measures has to be introduced that to allow us to reimagine methods in which we do work, how we educate and do business. And these methods are new to many of us. Some have existed for a long period of time, or we may have not been fully utilizing these. But from this, we have observed challenges, and we also have identified potential rewards. Either way, we anticipate that long-term and short-term, there can be positive effects based on what we are seeing. Statistics from Statin reveal that in July 2019, that the total employed labor force increased by 34,200 persons relative to July 2018. And in July 2020, following the onset of the pandemic, the employed labor force declined by 135,200 persons relative to 2019. As the local and global economy trended toward recovery in July 2021, the employed labor force increased by 93,400 persons. This rise, however, has not accounted for the total job loss in the previous year, nor the potential jobs that would have been created during the pandemic if it had not occurred. But we estimate that labor productivity in 2021 will start to recover, markedly not as what it would be pre-pandemic levels. And preliminary estimates suggest that labor productivity for April-June 2021 rose by approximately 5% relative to the same quarter in 2020. Growth in productivity is expected in industries that have experienced higher levels of rates of growth in real value-added output. The unprecedented impacts on the labor market due to the pandemic has been many. And these include, and we have heard many since we have been speaking this afternoon, reduced labor hours due to layoffs, ill health, death in some cases, restricted movements, reduced demand for goods and services, disruption in supply, a slowdown in labor reallocation, significant reduction in the creation of new jobs, a change in employees' attitude to work and workplace, a shift in where and how we work, as well as new opportunities to invest and adapt to technology. While productivity in Jamaica was on a decreasing trend for the last couple of decades, 2018-2019, we saw an estimated low but positive growth. The shock of the pandemic would have caused record-breaking declines in these growth and employment, and will no doubt impact productivity levels. So factors such as low economic complexity or low value added and unvaried production, lower investment in capital and deficiencies or gaps in the educational sector or human capital development, in our country were highlighted as some of the cases that were extensive. Across the globe, the pandemic has caused disproportionate impacts which have had severe effects on wages, livelihoods, and health of the low-income workers. Service industry workers, women, informally employed workers, and young people, as was mentioned by POJ, are among those who face the greatest challenges. And so service industry workers were impacted by their inability, for example, to travel to clients and limited ability to interact face-to-face. Employment for women declined faster than their male counterparts. Additionally, women were more likely to care for their children or those who are sick, and some have been even willing to take job cuts or lower wages to ensure that they take care of their families. Young persons also lost their jobs at a rate faster than those over the age of 35. Additionally, there was economic inactivity among young people as financial and restrictive measures limited their abilities to find jobs, internships, and undertake education. As such, we expect that these will cause some long-term gaps in lifetime earnings and experience. Informal work is often linked to the service industries, such as travel and tourism, for which the pandemic has had the greatest impact in this area. Educational attainment is another area that requires careful strategizing on our part to reduce the long-term gaps and impacts. Due to school closures, many students were unable to attend school, and they did not have the requisite devices, etc., to access internet or the platforms or have proper supervision to conduct their studies. And these are more likely to have impacted our low-income and rural households. And we have done studies and even included these discussions in fora that we have put on with the help of the ministry to stem some of these issues. There are also concerns that those who are able to attend virtually may not have grasped as easily as those who are exposed to the knowledge inside a classroom. The changes in the world of work are also likely to be a mainstay after the pandemic has passed. More emphasis has now been placed on worker well-being and worker-life balance. Employees have been given time and opportunity to engage more with their families and to evaluate their careers and even the conditions under which they work. More and more workplaces involve greater interactions between one second. Okay. Right. More employees are now given more time and opportunities to engage more with their families and evaluate their careers and even the conditions under which they work. And so more and more interactions are now found between people and technology, and the use of technology for collaboration and e-commerce. This means that the labor force needs to have the requisite skills to work with technology and in a technology-enabled environment. In addition to technical skills, employers are realizing the value of soft skills. Organizations are now realizing the importance of measurement and measuring productivity, especially in a hybrid or working remote situation. So awareness of the need to collect this kind of data is important, and it's only through the measurement that we'll be able to make decisions based on facts and not on opinions, as we have seen in some of the presentations that we have made today. And so this culture of measurement is something that we want to promote so persons can make the right decisions that is best for their industry or organizations. Another change in the pandemic in the labor market is the exposure to the wider use of flexible work arrangements. Essential, it has been at testing and has raised many questions as it relates to are persons more productive or less productive? And preliminary results from a perception survey done by the Jamaica Productivity Center found that respondents felt that productivity or flexible work arrangements increase their ability to be productive, balance work and their personal responsibilities, and complete their tasks fully at their own convenience. There are also some who thought that there may be increased distractions if they work from home, for example. But across the globe, more and more companies are adopting the stance of remote or hybrid work structures, even more so now during the pandemic. And globally, workers' attitudes towards employers have changed and is now dubbed the Great Resignation of employees. And there are trends right across the world where persons are leaving work, sometimes not to another job, but just for a change, having gone through the pandemic and experienced different working situations. And depending on how their place of employment performed during the pandemic in terms of, on the softer side, would determine if they continue or not. And so we are seeing many executives, C-suite, senior exec. So there is a huge skill gap or talent deficit that is seen worldwide, and it's also dubbed the great attrition. But it can also be a great opportunity if persons can change the culture and way of doing work to attract the best talent during this time. But we are also seeing that trend starting here in Jamaica, and we need to pay very close attention to that. And earlier this year, the Ministry of Labour established the COVID-19 task force to assess the impact of the pandemic on our economy and to make general and specific recommendations for recovery and building resilience. The task force was led by Professor Neville, and they engaged in a wide cross-section of the Jamaican economy and stakeholders in their deliberations in order to get first-hand knowledge of the impact on the pandemic. The task force has found that a more people-centered approach is needed in order to achieve significant improvement in productivity. This approach, according to the task force, must be underpinned by 4 very important elements of the transformative strategies for productivity improvement at the workplace. These include trust, building lasting bonds of trust between employer and employees, creativity and innovation, building the capacity of employees to be creative and innovative, strategic involvement, utilizing the technical, professional, creative, and innovative competencies of the employees in the planning and execution of transformative initiatives, flexibility and adaptability, utilizing these skills to adjust to the change in location and nature of the workplace for the future, which will be dominated by disruptive technologies. These recommendations have been fully adopted by the Ministry of Labour and Social Security and other ministry partners, and have been included in the strategy going forward to ensure that the labor force would have the skills needed to be competitive, innovative, and productive. And as we adopt this people-centered approach, we believe that measurement will be key, doing things differently, and doing so to bridge those gaps that we are seeing trending locally and the ones to come that we're seeing globally. At this time, I'm going to ask Gillian to come in and speak more on the labor laws side.
We are definitely running out of time, but the labor laws section was very important for us because we are getting the concern right across private sector organizations that must employ individuals. And especially with court cases, I do believe they need the guidance. They feel like they're almost on their own. It would be wonderful for Ministry of Labour to take a very proactive approach in going out to the Employers Association, to Manufacturers Association, PSOJ, just getting all of them on board, and for the ministry coming out of today's activity to take charge in helping them to navigate the waters.
Thank you, Chair. And I will pick up on my colleague's presentation just to say that this trend, global trend in terms of the Great Resignation, is something that Jamaica needs to be mindful of, especially since I, at the Ministry of Labour, have come into information from the Companies Office of Jamaica that suggests that it processed 3,000 new company applications and over 12,000 business name registrations in 2020-2021, representing a record number of new business activity in Jamaica. This shift from employee to self-employed or own account worker is noteworthy in terms of the labor market in Jamaica. So it appears that persons are willing to do their own business rather than be employees in Jamaica, and they're doing business both locally and overseas. The statistics and trends that have been shared by the PIOJ is acknowledged by this ministry, as we are also seeing those trends, and the concerns of both the JMEA and also the other public, private sector groups is also one that we are well aware of. And I just want to jump right into saying that we are all responsible for the solutions in terms of safety and health in the workplace. It is not an employer responsibility only, it is also a worker responsibility. And in saying that, I recognize that the voice of the work representatives is not present in this particular forum. I don't know if they were invited or they will make a presentation subsequently. But it's important in terms of the tripartite representation and buy-in or acceptance of the policies and procedures and general direction that we have all persons present in this kind of social dialogue. The Ministry of Labour and Social Security has indicated repeatedly in public fora that we support the vaccination of workers and employers, as many as are ready. However, we recognize from the daily work that we do that there is a general hesitancy in relation to some workers. And the hesitancy I would summarize as being one of uncertainty in terms of the efficacy and the impact, long-term impact of vaccination. And it appears to be the main reason that workers are expressing this hesitancy. So I believe that all hands should be on deck in terms of this kind of public, greater levels of public information and accessibility, similar to what I would have heard from some of the speakers that went ahead of me. The Ministry of Labour and Social Security, by reason of our legislation, the Labour Relations and Industrial Disputes Act, may intervene in matters that are brought to us that represent unjustifiable terminations or unjustifiable dismissals or breach of contract. And what we recognize is that there are companies that have taken the opportunity to encourage vaccination, but we have to ensure that the rights of both the worker and the employer is recognized in that approach, and especially where there are representatives of workers, that they are part of that discourse, that dialogue. The general issues that we have heard, and I speak about those from the worker perspective as well as the employer perspective. And I just want to clarify that a lot of employers believe that the Ministry of Labour is there to represent workers, and that is certainly not so. We're there to protect the rights of both the worker and the employer alike.
Please repeat that, Mrs.
The Ministry of Labour.
And
I will say it again because we get a pushback from employers as if the Ministry of Labour is for workers. The Ministry of Labour is here to ensure that the rights of workers and the rights of employers are protected. We are here to ensure that decisions are made in the national interest. And that is a very serious statement. The pandemic is a very serious matter. My colleague would have indicated that as the pandemic and other issues relating to the world of work changes the way that we operate, we must move up, ahead with certain legislative amendments. And I will admit to you, Chair and members, that the labor legislation would not have contemplated some of the questions and concerns that has been brought about by the pandemic. And post-haste, we need to get to a place where we review some of this legislation. I'm sure Mr. Wan will be happy to hear that, but I have not said that we will extend the periods of layoff, because definitely we have to look at a balanced perspective. However, social dialogue is what is being used in many countries to arrive at amicable resolution. So the concerns that we've had from workers, and I'll go to employers thereafter, is that they believe, like employers, that there are serious legislative gaps that must be addressed by the labor laws. And it includes the fact that they are not being paid for no movement days, which the law indicates that they would not be paid for no movement days, where they are daily paid or hourly paid workers, because they would not have worked. And the framework to address COVID-related absence in terms of quarantine, extended illness, that is not addressed by the law in its entirety in terms of the Holidays with Pay Act. It speaks about ill health related to COVID. Well, not ill health generally, and how to treat with that, but it does not speak about periods of travel-related quarantine or community lockdown or those kinds of restrictions.
Let me ask you a specific question, Mrs. Corodos. So you have an employee who has, say, a contract, or is a permanent employee who says, the Holy Spirit has told me not to take the vaccine, and I am not going to be vaccinated, even though my employer is vaccinated and everybody else in the employee is vaccinated. The Holy Spirit told me not to take the vaccine. Now, from Ministry of Labor's position, what happens with an employee like that? Is it that because it is a religious decision, then you continue to pay, or, you know, what happens?
Well, that's a very good question, Chair, because that is one of the major gaps that we have in terms of the legislation right now. And that worker would have to prove before, up to the level of the tribunal, that the action of the employer would have resulted in their unjustifiable dismissal. And each case is held on its own merit. What I will say quickly is that policies can be implemented by employers. However, those policies would not be able to take quote-unquote retroactive effect. And if those policies change the terms and conditions of the original contract, it should have some levels of discussion, discourse, and an understanding between the parties. And Chair, I think that this question is one that has gone to court in many instances. I would hasten to say that the Ministry of Labor has had a few collective disputes reported. However, I am happy to say that the parties have, in all cases, been amenable to having further dialogue at a local level. And I hope that they will be able to arrive at amicable resolution of those disputes.
Through your chair, on that particular issue, the Laredo, I wanted to ask you two questions. So let me just declare that I was a labor man, still is, back in the day. So I am quite familiar with Laredo. With the Labor Industrial Relations Act, first, what what does it say about persons who, employers' right to a safe workplace? Because I know that is an issue. So I wanted to remind us of that. And in a scenario where I go to work, I'm an employee, and because of the lack of enforcement of certain health and safety regulations, I come in contact with COVID, who becomes liable? Because it's no longer a safe workplace if my employer doesn't provide a safe workplace for my selling my services, because that's what it says. So those two questions kind of comes up, and I know it's a difficult one, but let's see how best you can.
Well, it's not too difficult because the Labor Relations and Industrial Disputes Act does not speak specifically of safety and health in the workplace. What it does is to refer to the Labor Relations Code of 1976, and that is what gives guidance in relation to how the workplace ought to operate, and suggests that the employer has a right to ensure the safety and health of its workplace and its workers. And correctly so, it must take all the steps that are deemed necessary. But that same code, because it is referred to by legislation, in a previous case, it was deemed by the Privy Council that that particular code takes on the form of law because it is mentioned by the Labor Relations and Industrial Disputes Act, the Lerida as he would have used it. So pretty much what it is saying in that code also is that there are particular steps that should be taken in terms of the security of workers, security of tenure, and all of that. So it balances itself in terms of the rights of workers versus the rights of employers. And again, it does not give a specific answer to the question that you've asked. And there lies the problem that the labor laws as they are do not give a specific answer, and therefore each case is given on its own merit. But one thing I will say again is that the matters that will result in adverse action against an employer would have to do with whether or not a worker has been unjustifiably terminated. So if all the necessary steps have been taken to ensure that workers are treated fairly and justly, I don't know that an employer can be found to be in breach of that legislation.
Just following up, so I know specifically we have been going towards the firing of persons, and I think there are many steps before we even reach there, really. So what I'm trying to conceptualize is really if we have a workforce or employer who employs 300 people, and this person is adamant that they're not going to take a vaccine. Now, while we're discussing COVID-19, there are many other pandemics that's out there. It could be Ebola. It could be any form of health-related illnesses. Mm-hmm. And this person is adamant that they are not willing to take a vaccine. Then that now puts your entire workforce at risk. That now affects your bottom line because that now is a major risk to the viability of your entity. So what I'm trying to conceptualize is how then would an employer trying to balance that, listen, I really want to keep my business going with all the best wishes in the world. However, you have persons who, for whatever reasons, will insist that they're not going to take a vaccine or they're not going to take any form of preventative measures to secure themselves. So it now exposes you as an employer. So I'm not taking any sides now, but I'm just saying from where Lerida stands, we must, somewhat put our Labor Industrial Relations Act in the 21st century where we can foresee, or not say foresee, we can put in a scope wide enough where we can accommodate these form of variations within the workplace. Because again, as I said, we are kind of hell-bent on COVID now, but in another 2 years, it could be something else, right? And we are back having this same discussion about, whose right is being trampled on and persons being fired. And I agree with you, there needs to be a conversation between employers and employees, as to what is happening, because again, you have to appreciate, when they were employed, we didn't have a pandemic. So the context is completely different. When they were employed, we weren't suffering hemorrhages with the economy, and we weren't struggling to keep our business afloat. So it's a very different context, and I think just looking at it blankly, it's somewhat not giving the matter any form of justifiable room for discussion. But what I would say is, if it's updating the act, that is something that we need to fast track, because now we have employees left, right, and center hell-bent on, carrying their employers to court, and some of them are really looking some money from the employers too. Let's admit it. They're really trying to say my rights are being trampled on, so I need to be compensated. So I think where we stand, and I'm a part of the government, is really to get this act up to date, where we can have an act that supports both employees and employers. Thank you.
Okay.
I made sure to ask that particular question because I know over time it is one that is going to need to be resolved, especially if COVID continues for a long while. I actually know of a situation like that. I think the person's contract is 2 years. It's a housekeeper, and the housekeeper continues to be paid, though have not turned up for work for more than 6 months because the Holy Spirit said, don't take the vaccine. So how long would we argue that that person continues to be paid while the Holy Spirit said, don't work? So we do have some real situations out there. I saw Mr. Wan's hand up as well. I'll allow him to go before Ms. Carruthers come back in.
Thank you, Madam Chair, and I apologize for coming in the middle. Just want to say the matter that the member just brought up about the safe workplace, I believe that is better housed inside the OSH bill as opposed to the LRIDA. And we do have time right now because it's still pending and there's a chance to modify it. Thank you.
May I continue, Chair? So Mr. Wan has partially answered your question in terms of legislative amendment or legislative work that could be done, that there could be a contemplation as part of the occupational safety and health legislation, rather than as it is in the Labor Relations and Industrial Disputes Act. It really doesn't address that matter. What we are working with is an old Factories Act that would have some bearing on that question. All right, so I was just expounding that the concerns that we've heard is also coming from the employers, indicating, as we would have heard earlier, that they are experiencing significant loss in income due to entity closure, border closures, general reduction in trade, and the increased cost of sanitation, absence due to COVID illness and COVID spread within the organization, vaccine hesitancy as they're concerned, lack of clear guidelines on government vaccination policy, and the policy for remote work. As it is, we recognize that there is plausible argument and concern on both sides, and as a ministry, we are willing and ready to participate in conversations. However, I think that post-haste, and I'll say it again, that legislative amendment is going to be needed because we are guided by legislation and will have to move in accordance with that legislation. However, Chair, based on the scenario that you gave, that would be answered not in a COVID context, but in the context that if the person has failed to turn up for work or followed the lawful instructions of an employer, that employer could take action in a manner that is in keeping with the law. So some of these questions can still be answered outside of a context of quote-unquote COVID.
But that's difficult, Ms. Carruthers, because that employee could say, look, it doesn't matter if the Holy Spirit tells me not to take it. I'm willing to come to work, but I'm not getting vaccinated. You have to accept me unvaccinated. So it's not my choice not to work. It is your choice not to have me work.
So there are difficult situations, and again, in the absence of specific laws to address this, the ministry continues to encourage consultation and dialogue between the worker and employer. And I will say to Mr. Wan that I have seen, for instance, in the hotel and accommodation industry, that through dialogue and those kind of accommodations, they have been able to be on a path of recovery. They were able to, by agreement with their workers, employers were able to extend periods of layoff, where the workers would have voluntarily agreed and signed to such agreements. And they have been able to systematically recall those workers. And I have been told that many of the hotels are up to 70+% occupancy levels. And I believe that Jamaica needs to look at all sectors and to see how we can adopt some of those approaches by sector. And I would also want to commend the global services sector, otherwise known to us as the BPOs, because they are also a labor-intensive industry, and they have done very well in relation to the retention of workers, and even have plans to expand and increase the number of workers in the upcoming year. And also that they have done so in a very relatively safe manner, given that they are a very labor-intensive industry. And they have also had a good model of remote work as well. So we can learn from the industries that are around. And I will also add in closing that Jamaica, like many other countries of Latin America and the Caribbean, are at the same place, and even venture to say that we're at the same place of challenges and opportunities with other developed countries. And as soon as we're able to sit together and hammer out a systematic way of dealing with some of these challenges relating to COVID and the labor market, we'll be able to have sustainable growth and development. Thank you, Chair.
Thank you very much. Dr. Henry, I'm definitely going to be depending on you a bit to just keep us abreast, because your agency sort of segue across committees in terms of us having an appreciation of the impact, both in terms of government funding required to continue to keep organizations, keep the government moving, keep Jamaicans managing during the pandemic, as well as what we found as a key concern. And I do take your point. We didn't have the ability to have the trade unions come in today. We decided we would look more from the perspective of employers, because we saw what it was having in terms of the vaccination process, just generally how we dealt with the pandemic and how it was affecting business and the economy. So we took it more from that stance. Yes, we will look at the contribution that trade unions can make to the discourse, because it is really all in an effort to get our economy and productivity going again. And that's why we called you in to take a look. So we're going to be depending on you, and we will have discussions as well with the Ministry of Labor, because it is very, very important that we keep sight of what it is going to take for the economy to get back on track, because all of us depend on our economy for our very survival. And so I'd love to say thank you to every single one who came, who presented. And as I indicated earlier, we're actually going to promote the discussions, because no matter how much we speak, Jamaicans today they haven't heard. They didn't hear the news, they didn't hear the radio, and they really don't know what is happening. And we thought it was necessary for them to get that appreciation from Ministry of Labour and Social Security, from yourself, from Employers Federation, Manufacturers, PSOJ, as to how we are all a part of the equation. Yes, Dr. Henry.
So thank you, Madam Chair. You had asked earlier about the reporting on the September quarter. So just to indicate, we have our press conference scheduled for next Wednesday when we report to the country on the September quarter in terms of economic performance. And on the matter of impact of recovery thus far on MSMEs, still a little early as we continue to see the gradual relaxation of measures, but we anticipate that it would be positive in terms of economic performance because you're seeing increased hours of work, you're seeing greater benefit derived from the linkages with tourism as tourism continues to resume and a number of the spin-off activities as tourists are facing greater relaxation in terms of quarantine measures and the ability to engage with the local economy.
I heard a concern of Mr. Mahfood, and I think it is going to be a concern that will resonate going forward. So several of the concerns raised, we have taken note of them from the Employers Federation, from the JMA, because in addition to the issues, yes, of interest rate, of inflation, that will impact us, persons are in fact concerned that if we open up and we are not able to get to our vaccination numbers, we are going to have this cycle of possibly needing to go back into lockdown. It is not a nice thing to say, but a reality that we must face. And I will also try to look from my various committee responsibilities as to what our experience has been with the take-up in vaccination once we start to see the spike. I don't have anecdotal evidence, but my observation, even if we did not give Pfizer, is that persons start to get vaccinated when they see the death rates going up. And that shouldn't be, but that has been the experience. So once you're at, Mr. Mahfood, a place of seeing a spike, seeing the need to hospitalize, seeing the deaths, we need to look to see if that is what it takes for Jamaicans to appreciate that they need to get vaccinated. So we're going to have to track that correlation. Ministry of Health may be able to give us some guidance as to whether or not that has been the observed status of individuals. So if we get the spike, if that's when we see the spike in vaccination as well, I'm not sure if we've been tracking the trend. Yes, Mr. Henry.
I was going to suggest also, Madam Chair, if the BOJ be called upon at some point to just discuss some of the deliberations that would have informed their policy movement, right? Just, you know, from where
Absolutely.
they sit, they're having a mandate for inflation targeting.
Absolutely. Thank you.
Thank you, Chair. I was going to Mr. Henry, Dr. Henry, I should say. In terms of, we have seen, and many members have spoken about the massive investment in technology. I wanted to find out if there was, your department or your agency have reported any efficiency gains, because I do recall about 3 years ago when I looked at the production and productivity report for the Caribbean, Jamaica wasn't the most stellar of performers. Now, with this massive, and I don't remember the figure that Mr. Mahfood had indicated earlier in terms of injection in technology, and also investment in new workflow processes of how work is carried out within the organization. Have your agency gone about measuring the level of inefficiency gain and production and productivity for various industries? Because I do know that some will, you know, like a farmer cannot really do much about it, but a BPO can.
Well, thank you very much, member, for the question. Good question. And so two things. We've done assessment on productivity generally pre-COVID, where we've spoken to cabinet and given some recommendations in terms of the types of industries and directions to go. as identifying productivity as a key driver for competitiveness and overall economic growth. As Mrs. Nelson from MLSS said, part of the challenge now, it's too early to do that assessment now in terms of COVID, as it's still ongoing and the numbers are still growing in terms of the infusement of technology. But as she highlighted, we're in agreement with a lot of what she said. One, there needs to be that sort of monitoring and evaluation framework of as we are, as a country and the global economy is thrust into these new modalities that are more technology-enabled and dependent, how do we measure output in that context? We've been doing that at the PIOJ because a call came when we started this last year, as we were getting into lockdown mode and wanted to do more work from home, that the call from certainly to the public sector through the Cabinet Secretary was, let's put in place these stronger accountability frameworks to ensure that the work of the government will continue to get done. And so we had done that where we could measure deliverables. Now, is that the best measure? It worked for us because in normal times, we'd have certain deliverables that we have to meet. And we just wanted to have that framework in place that as we enabled the team, our work force to work from home and our ISU, etc., really facilitate that in a relatively short time and in an efficient way, we were still meeting those deliverables. And so that became for us a proxy of productivity, as you're hearing now. But on a wider scale, you'd have to determine how do you measure output. In some cases, it's a capacity issue. How do you break down, tasks in these measurable frameworks? So if I'm doing a chapter, and we normally measure as we complete a chapter, well, a chapter may not be completed until maybe 3 weeks. How do we measure it on a day-to-day, week by week? Just having a framework. And because we do a lot of contract and project sort of analysis and put things in a project framework, that may come relatively easily for us, but then across the sector, public sector, private sector, that may not come as easily. So it would need, to build capacity to do so. How do you projectize deliverables to know that people are being effective? So more would need to happen. I think it's an excellent question because we are speaking now to part of one of our targets on the Vision 2030 is that Jamaica is a technology-enabled society that would drive us for more productivity, more efficiency. That means how we deliver in terms of teacher training, that as we look at teachers and some of your best teachers in a face-to-face context may not be the best in a technology modality. How do you infuse that in the teacher training modalities at our teacher training institutions? And how do you measure that? And so the recent study tour with the US in terms of technology framework, we looked at adaptive learning technologies through the Arizona State University. So that's ongoing, something we're going to be reporting that shortly. As you know, that was a sort of, a Jamaican contingent of a multi-sector, multi-ministry contingent, and very promising. And so I don't want to speak prematurely or out of turn, but some very promising outcomes that would speak to learning at learning technologies and what we call adaptive learning, where we utilize technology to better target our children and the types of learning styles that they have to improve learning outcomes. So there's more to be done. This is early days, but it's certainly on the radar.
Thanks, Dr. Henry. Team, before we close, I'm going to ask that we just vote on adopting virtual meetings going forward. So we would have voted to take it to Parliament, would have been considered, and have made its way through the Parliament. We'll just want to confirm that going forward, we would want to do some virtual sessions. Can someone move? All right, and so moved by member, Henriquez is seconded, and member Wilson is the mover. Dr. Henry, you may hear us coming back to you. We won't take up too much of your time, but members, I would recommend, even if virtually, that coming out of this session, in addition to promoting the presentations made, that we take to Parliament some of the recommendations and the concerns coming out of today's session in a committee report to the Parliament. So I'll ask us to work on that, even if virtually. we will set our next meeting date through round robin via email instead of doing so today. And once again, let me thank everyone for being here today. It's very, very valuable. Minister of Labour will see us calling on you privately. Thank you so much for being here. Appreciated. I now move that the meeting for today be adjourned. So moved and seconded by Member Henriquez. So Member Wilson, and Member Philip Henriquez. Thank you very, very much, everyone.